Is that what you're saying? Yeah.
Hello, this is Kathy Brown of Brown is Social Media, and it's time for another edition of What's News in Healthcare Social Media. And today, my guest is David Harlow. David, would you like to say hello?
Hello, everyone. Nice to see you.
And David is not new to Hangouts here, and he's not new to What's News in Healthcare Social Media either. He is a health law attorney with the Harlow Group, and he also is very well known for his blog, Health Blog. And I'd like to welcome you today, David, and you're going to bring some really good information to our subject today, because it seems like today's topic and the whole week's topic has been a lot around healthcare crisis management. So,
yes, well, we're always in crisis, right?
we are always in crisis. This is an understatement. So I wanted to start by talking about why this is a topic that's timely today. One of the reasons it's timely is the recent Ebola scare that we thought we had the two medical workers who were brought and treated, and there was an initial panic of having them come back to the United States with this illness that a lot of people really didn't understand. And then most recently we had a third, and I believe there's now a fourth person, is that right? A U.S. citizen?
Right.
And they're being brought back to be treated. And when the first two people, when they came back, there was a real issue of people questioning whether or not these people should be brought to the United States and whether it was putting us at risk. And that really was a PR crisis for Emory University Hospital to make that decision. And so following that decision, there were a number of articles talking about how well they managed that situation in getting the public to understand the illness and really the risks that were presented. So I thought we would start out with the first topic, which is it's a source from preparedx.com, 3 important takeaways from Emory University Hospital's Ebola controversy. And I want to start by saying we may not address these articles one after another because I think they kind of intertwine. Do you agree, David?
Right, yeah, we're talking generally about crisis management and crisis communication, and there's a whole host of things, of learnings here, from including, and I think maybe this is where you want to kick off, is the notion of how active do you want to be. There is a notion that we have these tools at our disposal. We need to be extremely active, and sometimes, as they say, discretion is the better part of valor. You could say discretion is the better part of crisis communication as well.
So do we really have a choice whether or not we want to be out there? Because once a crisis hits, it's going to take over in social media whether you choose to go out there or not, right?
Well, that's right. It's always a question. I think the communications professionals will often say, well, you need to be part of that conversation. You need to be able to shape that conversation in the direction of the conversation. And I guess what the other side of the coin is that maybe there are times where you want to follow the conversation for a while before jumping in.
Mm-hmm. Well, let's start by talking about some of the recent crises, because there's more than just one. There are a lot of, if you Google, you'll find all kinds of healthcare crises, but let's talk about some of them that are just examples of crises that we know about. I know the Emory University talking about bringing Ebola patients back to the United States and the risk of infecting the general public was something that a lot of people wanted to just leave where it started. What are some others?
Right. Well, I spent a couple of days this week at a conference here in Boston. It was the HIMSS Privacy and Security Forum. It's really focused on chief information security officers of healthcare organizations, hospital systems, and the like. And one of the speakers was the CIO from Children's Hospital up here in Boston, and he spoke about his experience of having his system attacked by Anonymous. The guys wear the Guy Fawkes masks and threaten to take action through denial of service attacks on websites. They had targeted Children's Hospital because of a controversial child custody issue involving a girl who had been an inpatient at Children's for about a year, and I think there had been action to terminate parental rights of the parents because of failure to get her into treatment, etc. A dispute, not quite sure why Anonymous would be involved, and I guess in the end it wasn't clear whether it was in fact Anonymous or somebody operating under the name Anonymous. Hard to know who you're dealing with if you're dealing with an anonymous, loosely organized organization or non-organization. So I think the upshot of that particular instance was the folks at Children's Hospital decided both internally and with the advice of law enforcement not to engage publicly on this issue. So they received these threats. Some of them were posted on YouTube. Some of them were posted on Twitter. Release this girl or we're going to take you down, basically. And they ignored them, and they hardened their systems. They brought in some contractors who were able to help them out on that front. But in the end, at the height of the attack, they had 30 times their usual web traffic, which was directed to their website through a directed denial of service attack orchestrated by Anonymous or somebody claiming to be Anonymous. They're able to deflect most of that traffic through a bunch of technical tricks and working with outside contractors. But the point here in terms of communications is that they didn't engage. They didn't engage with the person posing the threat or threatening the organization or its infrastructure. And in the end, a newspaper article appeared on the front page of the local paper, and within a day, the attack dropped off because another Twitter account that appears to be the real Anonymous said, "Knock it off, folks. This is a children's hospital."
Oh my! Well, for those who are not on the event page, I'm going to share. I did. Oh, was that not going to give us the link? It's not. I thought maybe if I did the comment that I put on the event page, I could show the link for the recorded version, but I can't. So on the event page, I shared a link to that article, the HIMSS reference that David has talked about, so you can see that and follow that later. So that's funny that that most likely the person that was trying to claim Anonymous was not really Anonymous, and Anonymous, who became less anonymous, said that it wasn't them.
Right, yeah. So sort of wheels within wheels of identity and all that good stuff. And, we say all the time, claim your identity, do not be anonymous online. Of course, if you're a international cabal of hacktivists, you're not going to claim your own identity online. But what was interesting here is that the Twitter account that does seem, in fact, to be the voice of Anonymous said, "Knock it off. It's a children's hospital."
Well, that's an interesting case of not responding and not fueling the fire. And this may be a very unusual case that not many people are ever going to experience, but there are cases where people are having crises that are happening all the time. Like, I was surprised how many different news articles over a several-year period I saw where medical records were found in a dumpster. And
yeah, there's more of them every day, more of them this week. This is even a case, you think that sometimes somebody would even do this, not really thinking about it. The most recent case I heard of involved someone taking several trips in their car or truck with more and more files to the dump.
Yes, well, in one of the articles that I read, I could see how it happened because they said it was a physician who had passed away. The building had been left empty for a couple of years at least. A new business came in, bought the building, and they dumped out the previous tenant's items, which happened to be medical records. Now, you can't really go back on the physician. He's not around anymore. But whoever owned that practice, which very well could have been a a hospital, not necessarily that physician acting as an entrepreneur, that still comes back to haunt them. So there are a lot of things that can happen you don't think about until after the fact. And in the case of someone who no longer works for you and maybe has been passed away for 2 years, you don't expect those records to show up in a dumpster, but they can.
That's right, and it's hard to say, who is. Can you really lay great blame at the feet of a landlord who has an old tenant's junk, as far as they're concerned, left over on the premises? There have been other cases, though, where healthcare organizations have done essentially the same thing. There's really no excuse for that. There was a case not that long ago of records being delivered to a physician's driveway, and piles and piles of cartons of medical records just left in the driveway, delivered there by a healthcare institution. It's not an appropriate way of delivering medical records.
Yes. So let's talk about some of the things that Emory did right and that other crisis situations could take this advice from. One of the first things is establishing what the real problem is. When something is happening, when you've got a news article of medical records in the dump, when you've got a patient coming from another country with a scary disease, what is the real issue that you're trying to address? Is it the medical records being stolen, or is it the actions of the employees? Is it the disregard? What is the actual problem? Is it a culture issue? Is it a particular act? Is that something that you think most people do? Or do you think that a lot of the people that respond go out and don't think about what the actual issue is? Because in the case of Your Anonymous, clearly they put a lot of thought into that.
Right. That's the hard thing to do, is when you're faced with a crisis, it's a crisis, and you need to react immediately. So the key to being prepared is, in fact, preparation. And there need to be a lot of running of different scenarios, planning, thinking this through, imagining what could happen. And the real difficulty here is that the things that turn out to be problematic are the things that nobody ever thought could happen. So it's really hard to prepare for the unknown. But we can model it. We can try to prepare ourselves for something that's sort of similar. One of the things that came out of the children's situation is that the decision was made at one point to remove the network from the internet as a security measure. And that meant no email, and that meant no electronic prescriptions to outside pharmacies, just as two examples.
That would be a showstopper.
I mean, that's not the kind of thing that any CIO anticipates ever having to do proactively. I'm going to turn off the internet. So there was no playbook for that. And they had to rely on good old-fashioned sneakernet for a while. People going up and down the hallways and across different buildings in order to deliver messages and information. In the context of responding to fear and concern about a very difficult disease like the Ebola virus, there really needs to be great care taken in order not to fan the flames. And there are certainly playbooks that an organization like Emory should have at hand for dealing with infectious disease, and in fact they probably did, in order to make the calls that they did, and to do it in a way that was pretty even-handed and non-hysterical, not responding to the hysteria in a way that could have been destructive.
Yeah, and I think that's important to point out, that what Emory did well is they focused on educating the public in mass rather than responding to every uninformed comment. And I think that that's an important point to make as we refer back to another article that I referred to, which is How to Create a Crisis Plan in 30 Minutes by Reagan. I don't subscribe to some of the advice that's in that article, and that's really why I put it out there. Not that I'm saying that that is a great thing to follow across the board, but it's something to talk about. And one of the things they talked about is get out there and respond instantly and do it to every message. And that's not always the best plan.
I think that that kind of response is important when you're talking about something that is really, reputation management. And to the extent that reputation management manifests itself through Yelp reviews and the like, it's important to have a handle on that, to control that. But again, it has to be genuine. The best way to address things like that is really long-term. Do what you do really well, encourage people to post reviews, give them links if need be on their way out of the office or through newsletters and so forth. But hopefully if you do that well enough over time, then one person posting a negative review is not going to create a crisis.
Good point. So let's reflect on another crisis, Johns Hopkins, where the GYN had a pen camera around his neck and had been apparently taking pictures while doing pelvic exams. That was one crisis that took place, and that was certainly brand management. How did they respond to the initial fears there?
Well, I think what happened there, my understanding, my information about that situation is really focused on the fact that this ended up as a class action lawsuit, and that was settled out of court. So that's one way of managing. That's one approach to managing a crisis.
However, David, yeah, that became another crisis because after all this happened, then the physician committed suicide.
Yes, physician committed suicide, and many patients of his from over the years essentially said, I have no trust for the medical system anymore. I'm not going to go back for another exam. So that's just sort of a time bomb for people foregoing medical care and potentially screenings and preventive care over time. So hard to say what do you do with that? How do you respond to that? So we're talking about many people who were treated at this academic medical center over a period of many years. There ought to be, and I imagine there is now in the planning stages there, though I don't have any direct knowledge of this, some sort of tremendous public education campaign that's not going to focus on the history here, but sort of proactively encouraging screening, preventive care, etc.
Yeah. Well, there is an interesting sub-article. If you look at the Reagan article, there's a link when is it the article? Maybe it's the preparedx.com site, the very first article I had. There was a side link going to a podcast, and that podcast is an interview with Jane Jordan Meyer, and she talks about emotional intelligence, and it's really an interesting conversation to listen to sometime when you have the time, because she explains emotional intelligence as being a sensitivity to things like this and being able to relate to people in a way that allows them to connect and trust someone. And she uses the example of Mayor Giuliani during the 9/11 attack and the fact that his response to how many people do you think how many bodies do you think we're going to count? And his answer wasn't 1, it wasn't 100, it wasn't 1,000, it was more than we can bear, which was a very emotional answer that gave an answer that was satisfying, and it spoke to the sensitivity of the issue.
Right. It's a rare leader who can step outside of the moment and deliver a response like that.
Yeah. And so one of the things that I would urge people to do in preparation for a crisis is to hash through a few what-ifs and have some scenarios that you play through, some of the things that are more likely to happen, records in a dumpster, a physician who's impaired, maybe a shooting through the hospital, and play through some of those things and then critique yourself and hone in on some of the messages, some of the do's and don'ts, so that you can have an action plan to go back to and already have learned from mistakes that you didn't learn from, that you were able to learn from before you made those mistakes, and have some of those things in the wings and ready to go.
Right. And if I can return for a moment to the idea of having sort of infrastructure ready to deal with the crisis that may occur in the future. The children's example, the hospital became disconnected from the internet. Hard to know how to deal with that. I'm thinking back to the Iowa floods of a couple years ago, and the experience of some of the hospitals involved, where records were lost, there was no information, phone lines were down, etc. What was notable in that setting was the use of Twitter as a form of communication. And in addition, what sort of some of the learnings out of that experience were that hospitals and other organizations ought to have the frameworks of special purpose blogs and websites ready to go. Not used, not live, but ready to be switched on in case of a crisis, so that you could have either a special section or a special blog dedicated to providing on-point information that is just sort of stored. It's in your back pocket. If this is part of your disaster planning, your communication, your crisis communication planning, you can have written all of this, and it's just something you don't want to post publicly now. But when you need it, you want to be able to post it immediately.
Well, and that's a great point, because one of the articles that I highlighted in today's discussion was also the use of promoted tweets, being able to use promoted tweets and the Facebook ads and have that ready, that when you have a crisis, you're using that to communicate and get your message to the front where people see that. And that's an excellent way to use some of those tools that we might not use every day otherwise. Just as a side note, I shared another link that you shared with me, David. I just put it on the event page, and it's the slide share, or I forget what you called that, but it's from the presentation that you just did this week, that I thought people would like to have that link to be able to see the slides that you had used in your presentation, so that you know that's out there and it's available to refer to.
Great. So that's also about, this is at the same Privacy and Security Forum, and I spoke there about social media, and I think some of the chief information security officers of health systems in the audience think of the use of social media as a crisis in itself, in the sense that it exposes a hospital network to a ton more malware. And even if you tell people you can't do this on a hospital computer, doesn't matter. Half the people figure out a way to do it, or they use their smartphones in a hospital network. And my key advice in this arena is for institutions to set up separate networks. Many, if not most, already do this. So there's a network for secure patient information. There's also a network for staff, Facebook use, visitors, etc. And even set up a room with a bunch of computers for people to use on their breaks, for their Gmail, for their Facebooking, so that is insulated from the hospital network, and somebody who downloads a game on Facebook that's infected with malware doesn't take down your clinical systems.
That is excellent suggestion.
Yeah. And then you don't want to turn people off. If you're the bad guy saying you can't use Facebook and Twitter when you're in the hospital, people resent that. And if you're the good guy and say, yeah, let's do this, we can do this, let's find a way to do it, let's put some staff who have nothing to do with IT on the committee that comes up with the policies, those policies will end up making more sense to staff at large. They can be disseminated more readily, informally, through people. If you put a charge nurse on the committee and he or she is communicating the output of that committee to colleagues informally, that's going to be a win. There's a lot to worry about in terms of putting these policies and procedures together, but it can be done in an inclusive way and in a way that leverages the workforce to be a force for good in terms of helping you communicate through social media.
Definitely. Well, I'd like the viewers to know that I have posted the link to join us inside the Hangout. Originally, we thought that David was going to have to leave exactly at 11:30, but he's been able to build in a little bit of a buffer, and so this is a rare treat that if you are able to join us, David is able to stay for a few minutes past the bottom of the hour, so this is the time to click on that link. So if you'd like to join us, look on the event page, and you should find a link that I've shared there. I don't know if we'll have any people. We have a lot of our viewers work during the day, and they take their lunch hour or their morning break to watch this, so I never know who's going to pop in. So we'll continue our conversation, and hopefully we'll have a couple people that are able to join the conversation. I know that one of the highlights of our conversation today, based on the chatter that I'm seeing as we're discussing, seems to be the emotional intelligence aspect of responding to a crisis, that it's not all about the facts. Sometimes it is about the emotion more than the fact. And that must be something hard for you to swallow as an attorney, right, David?
Oh, come on, I'm not that bad. I'm not Joe Friday, just the facts, man. Yeah, I think what's important is to recognize that if we're using a social medium, I mean, by definition, we're talking about interactivity. And it's a conversation, and it's not just delivery of information. It's a human connection, and we have to be aware of the human dimension to that. And it is emotional, even if it's just bits and bytes. So do recognize that.
Mm-hmm. So since I have you with me during this conversation, I'd like to pose this question because it's something that I really know very little about. When is it time to get legal counsel involved with responding to a crisis?
Well, I think that it would be worthwhile to have legal involved in developing a crisis communication plan, or at least reviewing that up front. So sort of in the planning stages. There are certain things to remember. There are, in the example of the Ebola crisis, the names of the individual health workers may have been public by the time they got to Emory. Can't remember exactly. But clearly Emory does not therefore have license to talk about their conditions unless they had been granted permission by the patients or their proxies. And it's important to remember that. It's easy to forget in the heat of the moment that there are privacy rules that need to be observed no matter what.
Go ahead. Well, I know that when you were talking about whether or not the names were known, I don't know if you noticed this, but there was a point when everybody knew which two people had been diagnosed with Ebola, and yet the hospital would not give the names of people coming to the hospital, and everybody knew it, and then the media started adding the names to it, even though it didn't come from the hospital. And I noticed that for a very brief time, it was, some people implied that they were not being forthcoming because they didn't understand that they were bound by HIPAA regulation, and it started to give the wrong impression of why the hospital was failing to name the people that were coming, and they started to wonder, was there more than two? Or are these not those two? Maybe there's more than just two.
Right. It's hard to get across the niceties of this rule, particularly in the context of crisis communication. Even in the day-to-day, if somebody posts on a hospital Facebook page something, about a good test result or a good diagnosis, they're engaged with the cancer center at their local hospital, whatever it is. Great news, got my numbers back. It's been 2 years, and everything's still clean. There's not much you can say back if you're managing that page for the hospital. You can post pretty much, thanks for sharing, and here, check out this link to our Center of Excellence. But not much more than that, because to do more presumes upon the consent of the patient and might overstep the bounds of how far the patient is willing to go in terms of being public.
Yes. Well, as we wait to see if anyone else is going to join us, I do want to do some quick just brush-overs of some recent social media features that have been added. I'm not going to do a whole lot of talking about it because we don't know a whole lot about it or there's not a lot to say about it, but one of the big ones this week was that they added the applause. Yep. Yes, David?
I think we do have somebody who's joined us here.
We do, and I'm not able. I'm waiting to find out if this person joins all the way because it's still coming across as unknown to me. So I think they're an incomplete connection. Is the other person able to hear me? Yeah, I think they may be installing a plugin because right now they're coming across as unknown. So we'll have to see.
Sorry.
So while we're waiting to see if that gets straightened out, Google did add the applause feature to Hangouts. I turned it on last night for a Hangout that I had, and before the Hangout got started, I turned it off again because I did some experimentation with it. And basically what it is when you start a Hangout on air, when you do a scheduled Hangout, one of the items, just like the promotions app and the Q&A app, is the applause app. And then when the Hangout goes live, people have the ability to click the thumbs up and thumbs down, and that creates an applause or a booze effect. I find that very distracting during a Hangout. I don't understand. Maybe if you're having some kind of a fun, I don't know. I just thought that it's great that it's measuring people's involvement in the Hangout and highlighting maybe those particular highlights of a Hangout. But when you have the booze and the applause noise to go along with it, I don't think that that's necessarily going to be something that I'm going to use a lot.
No, it sounds like a good old-fashioned, laugh track in a studio audience, or the lack of a studio audience on a sitcom.
Yeah, but the difference is in a sitcom, they actually have a sign that says "Applaud now." They don't just let people do it throughout the whole show. So I'm not sure that that was well thought out. Maybe if I see it effectively used, I might have a different opinion. But under the right conditions, potentially, if you're trying to do some kind of a fun hangout that you're building community relations, maybe that's something that you'd want to consider. There was also a message that came across that Google had added the photos option to the left sidebar tab of things to look at. Now, I've had mine for a while, so I don't know if I got a sneak preview and didn't realize it, but I shared it as new information, but I'm really not sure how new that is or that's worth mentioning beyond that. There wasn't a lot of new stuff going on with social media, probably because they were afraid that the thunder would be stolen by Apple's announcements and TEDMED and all that other stuff. So, okay, well, it looks like we are not going to have anyone else joining us. We've got someone who's attempted to join us, but I think they're just I don't think that their camera and mic is working. I think they're probably here, but they're not able to participate. I'll give you. Is the person who's joining us? Are you able to talk and ask a question? Yeah, I think that they must not have a functioning camera or sound. So, David, as much as we appreciate you being a part of our Hangout discussions, I guess we're going to have to wrap it up today because we don't have any way to interact with the guests that did join us. So, you are always a wealth of knowledge, and I have shared those links on the event page. I hope people will follow up and that you'll continue conversing with people about the topics that we talked about today.
Great. It's my pleasure to join you, Kathy, as always.
And this concludes this week's edition of What's News in Healthcare Social Media with me, Kathy Brown of Brown Nose Social Media, and special co-host guest, David Harlow of Harlow Group. See you all next week. It's still stopping. Okay, well, let's hope that this stops. If not, I guess I'll do some video editing later. This is about the time when I
shows is live on my screen here.
Yeah, I know, and it says it's stopping, but it says fails to stop, and this is about the time the viewers are going to start posting messages to tell me that it's still going live. Okay, we'll try this again. We may have to just bail out and let it time out after 15 minutes. That's what happens sometimes. So.
Okay.
That's what we may have to do. So I guess we'll have to just wrap it up here, and then I'll go back and clean up the end of it. So, well, it was a pleasure, David. Have a great rest of the week, and we'll talk soon.
Thanks, Kathy. Bye-bye.
Bye.